According to the Tulsa Health Department, our cases in Tulsa County over the last 14 days are in fact trending upward, not down. If we were to follow the federal standard locally, we would wait for the 14-day decline to occur and then begin rollbacks. But Tulsa does not exist in a bubble. We do not get that choice. Because of the state government's initiated rollback and the willingness of other communities in the region to follow it, we should expect more people to come in contact with one another, and we should expect the virus to spread at a more rapid pace in our metro area. As a result of that increased regional activity, our local health experts tell me that Tulsa's cases will not go down, they will increase. Waiting on those cases to decline as people for 100 miles in every direction are being encouraged to ease social distancing would be futile. Tulsans have already undertaken an unprecedented system of sacrifice to slow the spread of this virus in our community. While hard to do, most of us followed that plan because of the logic behind it pointed toward it being effective. And every indicator is that it was. I cannot, in good conscience, ask Tulsans to continue making these extreme personal and financial sacrifices at such a level in pursuit of a goal that will be impossible to reach in any reasonable period of time. It's also important to remember that the virus, as Dr. Dart just said, will not disappear on May 1st or any time in the foreseeable future. The point of our work over the last 6 weeks was to buy our healthcare system the time it needed to prepare for that long haul and to avoid a sudden surge that would overwhelm our healthcare system. After discussions with the leaders of each of our major health systems in Tulsa, I've heard from every single one of them that they're confident in the ability and in their ability to move forward and care properly for Tulsans as phased rollbacks occur. So our goal for the future is to continue managing risk as best we can while helping Tulsans go back to work safely. Our Safer at Home order will remain in effect through April 30th, at which time it will conclude. Effective May 1st, new order will be in place that reflects both the federal and state guidelines for phase 1 rollbacks. Our shelter-in-place policy will discontinue at that time. The state's guidelines for industry will be enforceable, and social gatherings should be restricted to less than 10 people in accordance with federal recommendations. This order will be adjusted when the state determines that phase 2 is to take effect. As we move forward, each of us should continue the same strategy we've deployed to date. Focus on the things that we can control. Heard from a lot of business owners who are concerned about reopening safely. If you don't feel you're ready to open with precautionary measures in place, we'll support you when you're ready. Thank you for putting the safety of your employees and your customers first. Employers should continue to facilitate remote work throughout phase 1 as much as is possible with business operations, again, according to federal guidelines. We'll continue to do that at the City of Tulsa. We should all wear masks in public, not as a sign of terror that we might contract the virus, but as a sign of respect to our neighbors that we may be carrying the virus without knowing it, and we're wearing a mask so that we can help reduce our ability to contaminate others. Non-essential travel should continue to be minimized, and if you're over 65 or have a compromised immune system, you should follow the state's Safer at Home order. For city park facilities, playgrounds, and recreation centers, they will remain closed. City pools will not be opened this summer, and day camps at city parks are canceled this year. Golf courses and tennis facilities will be reopened on May 1 with the safety precautions in place that Commissioner Keith mentioned a moment ago. The White House guidelines are really helpful. You can find guidance for individuals and employers through each phase of the rollback at whitehouse.gov/openingamerica.
To be clear, are you saying that you would have preferred to keep your shelter-in-place order in place longer but feel that it would be futile because the state has already begun reopening the state?
I would like to follow the guidance that the White House issued last week that said that we should have 14 days of declining cases in a community before you start rolling things back. That's the standard in it, not just from the White House, but a range of other studies that I've heard. But again, the reality is Tulsa does not exist on an island. We are surrounded by the state of Oklahoma. We're part of the state of Oklahoma. And the state of Oklahoma and communities all around us are starting to relax their social distancing practices today. And so I can't ask people that work at a restaurant in Tulsa to remain unemployed while we try and pursue a 14-day decrease, while restaurant employees in every community around us and for 100 miles around us are getting to go to work and contracting viruses and bringing them to our community. That's not fair to Tulsans, and it would be asking them to make a great economic sacrifice in pursuit of a goal that we would not be able to achieve because we don't exist in a vacuum. We are in a region, and we're not on an island by ourselves. And so that's what I have preferred, that we allow Tulsa and Tulsa County to hit that federally prescribed benchmark. Absolutely. But we weren't allowed to do that. And so I think the proper thing to do moving forward is to try and manage our risk to the greatest extent that we can. I will say one thing that gives me consolation in all this is the reassurance from our hospitals that they have the capacity to handle this moving forward. And so, that was one of the main reasons that we initiated this process, was that we didn't want our hospital systems in particular to be overwhelmed. And we've positioned them to be able to avoid that, thanks to the work that Tulsans and people in the Tulsa metro area, the sacrifices that those people made over the last 6 weeks.